Hi, it's Dr. Adrian from Advanced Dental Artistry here in West Perth. Immediate front tooth replacement with the dental implant. Well, 6 months ago I did part one of this video, and that was really the surgical procedure of how we actually did this treatment. How did we remove the tooth and actually immediately replace it with a dental implant, but also have a temporary tooth on the top? There was a lot of views of that video, and the main reason is it's a very common problem when we look at dental trauma. 50% of the population will get some sort of dental trauma, all the way from a little chipped tooth all the way through to knocking a tooth out, or several teeth out actually. So having trauma on the front tooth is actually very common. Let's give a quick summary of how this treatment came about, and I'll just summarize it very, very quickly. When we look at the tooth, you can see that the tooth is dark, it's dead, there's cracks all over the front of the tooth, and the patient had a root canal, but that root canal had failed. There was a root fracture and there was some root reabsorption, so this tooth can't be saved. So when we're looking at a young patient that needs their front tooth replaced, the best option of course is a fixed option, where we're actually replacing the tooth with a dental implant. So you can see here what we've done is you remove the tooth atraumatically. It means removing the tooth without any damage. We then remove the tooth, you can see there's no tooth here. We then have used a Nobel parallel implant here. It's a narrow implant, and we're using a narrow implant because we know that if a wide implant is placed, there's a large possibility that the bone on the front of the tooth will actually dissolve. Once the implant's placed, it's about 3 mils under the CEJ of the adjacent tooth. It's slightly palatal, so we can use a screw retained crown. We then of course have a gap between the bone on the front of the tooth and also the implant. So this is when we place artificial bone in this area. In this photo here, we've also put a scan body, a 3D scan body, so we're able to actually scan this case so we can actually get a porcelain crown made. The other problem we have, of course, is that the gum on the front can actually dissolve. So what we've done is we've taken a soft tissue from the palate and we've actually placed it on the front, the buccal part or the front of this area, and this is to thicken this area up. What we're doing is we're really ensuring that if there is any shrinkage down the track, that we've actually got more gum than is actually needed. From here we've got some options when it comes to the temporary. We can either use a immediate zirconia abutment, which we can actually get made if you have an on-site lab, or in this case we've used a temporary cylinder. And the most important thing is this profile. How do we actually get this beautiful emergent profile that not only makes the tooth look real but also supports the soft tissues? And this is actually placed. The only time that we can actually do this is if the implant goes through to a high torque, and we're really talking above 45 Newton centimeters, and then we can screw this directly in. You can see the results here. So here you can see the stitch. We've got a stitch actually holding the connective tissue graft in place, and you can see the immediate results here. That is a resorbable suture, and that suture will dissolve. It's a Vicryl Rapid, probably dissolve after around about 7 to 10 days, and that will allow the patient to, or that gum to actually heal nicely. So when you see some of these photos, let's look at some immediate photos here, and you can see that the temporary looks really good. You can see it's slightly shorter. We've taken it out of bite, so there's no pressure of course in the tooth, and you can see that it is slightly shorter, a bit out of bite. But one of the things that we saw immediately was that the gum was lower, and this is important. It's lower than the adjacent tooth, so we've got excess gum early on. Okay, we are going to see some complications with this case, so that's actually really good, because then we can actually talk about how we can actually deal with those complications. So this case is going to be left for 6 months. In certain cases, when it comes to dental implants, we only have to wait for 3 months for the bone to go into the implant. But because we did a bone graft with this case, we actually left it for a period of 6 months, and she was very happy to leave for 6 months. She had a beautiful looking temporary tooth. It didn't really change her appearance, so the temporary tooth was good to actually last 6 months. So let's see what happened after this 6 months period. During this healing phase, and this is around about 4 to 6 weeks after with the implant in, you can actually see that the healing is actually excellent. The temporary tooth looks really good. We then forward 6 months, so let's look at what happened over the 6 month period. Well, now you can see that we have a defect. We've got a defect on the distal aspect, the back implant of the tooth. You can actually see that this distal aspect, we've lost the gum. There's a defect in this area, and we're going to have to correct this. As I said to you before, one of the most important things is when we're dealing with front teeth, it's not just about making sure that we put a tooth in there, but it's also to make sure that it looks as natural as possible, and that is the gum and the supporting structure. So this is gum and bone. So what we're going to do here is, you can see at this stage we're going to start to make a permanent porcelain crown for the patient. This is a screw retained crown, and you can see that we made it in 2 parts. So the main reason for that is we have a lot of problems actually with these cases because of shade. When you're trying to shade match a front tooth to another front tooth, especially the central incisor, it's a very challenging case, and the technicians have to be real artists when it comes to these cases to ensure that this is actually correct. So the temporary crown comes off and you can see how beautiful the soft tissues are. We then place the new, or the implant crown, the new implant crown, directly into this area, and already we can see some problems. So let's go through some of these problems. The first, of course, is that gum. So when we look at the area, we already talked about how the gum actually is lower. There's a defect actually in that area, and that defect shows that darkening. You can see that darkening right on the distal aspect actually of that area, and that's going to be a problem for us. That's something that we're going to have to address before the final crown goes in. When we actually also look at the next problem we can see that on the natural tooth there's these little white flecks, and these little white flecks actually make the tooth look natural. On the new crown you can see that there's no white flecks, so of course that means that for a patient and for us when we're dealing with it, we really want this result to be beautiful, so that's something that we have to change. The other issue is the length. The length of the tooth is slightly shorter than the tooth on the left hand side, the patient's left hand side, so what we're going to do is we're going to have to lengthen that area. And the last thing we can see is there are going to be some challenging situations because the lateral teeth are different. If the lateral teeth are different, it will actually make the central teeth look slightly different, and this is something that we're also going to have to deal with. So what happens is we took that out, we rescanned the area, we took more photos, we put the temporary back in. The patient waited for another week while the ceramist spent even more time making sure that this front tooth was actually perfect. So all of those minor changes were actually done. So in these front teeth, they are complex not because they're in the front of the mouth, that does make it quite challenging, but because not only do we have to make sure that the implant is in the right position, we have to make sure that the soft tissues are great, which means that we had to do a second gum graft on that distal area to build it up, and we have to make sure the cosmetics are absolutely perfect, which is all those very, very minor details in order to actually get the cosmetics as beautiful as possible. If you have any questions, please give us a ring at the practice. You can leave comments below. If you do want our opinion when it comes to cases, please drop us an email or leave your comments below. I look forward to one day seeing you in the practice.